everyone. Welcome to the webinar. Today we are presenting Connecting the Uninsured with Financial Assistance, and we're so very thankful to be joined by the PAN Foundation. They have been a partner of ours for a lot of years, and they help uninsured people with life-threatening, chronic, and rare disease get the medications and treatments that they need by assisting them with their out-of-pocket costs and advocating for improved access and affordability. They are also a nonprofit like we are, and they have been amazing at helping to provide so many uninsured and underinsured people to afford their medications each year. We have two presenters today, Joan Zhang, who is the Manager of Medical Affairs for the PAN Foundation. She reviews the clinical parameters of PAN's assistance programs, including its formularies and pipeline research, and conducts outreach to pharmacies and related professional groups. We also have Audrey Corte. She's the Senior Manager of Provider Relations. She develops and implements PAN's provider outreach strategy. And she has over 10 years of experience in the healthcare industry, focusing on insurance coverage, reimbursement, and access to care programs. So I'm very thankful to have them both with us today. As a housekeeping note, everyone is in a listen-only mode, so you will not be able to, we won't be able to hear you. But if you have questions throughout the presentation, please feel free to type your questions into the chat box, which is located on the right-hand side of your screen. In the white box, there's a little place that says chat. If you click on that, a little chat box opens. You can write your question in that. We will have time for question and answers at the end, and I will make sure that if we don't get through all of the questions, that we get them answered to you individually after the presentation. So with that, I will turn it over to Joan, who is going to talk to us about the connecting uninsured people with financial assistance. Joan?
Thank you, Andrea. Hi, everyone, and thank you for taking the time today amidst everything that's going on with COVID-19 to join us and learn more about the Patient Access Network Foundation, or PAN for short. My name is Joan Zhang, and I'm the Manager of Medical Affairs at PAN, and I'm joined today by my colleague, Audrey Corte, our Senior Manager of Provider Relations. Today, we'll walk you through what we do, why we do it, and how you can apply and receive assistance with PAN. We know that we are going to provide you with a lot of information today, and that you may not be able to absorb all of it. So we encourage you to send us your questions, and we'll have a question and answer section after the webinar. First, let's start with why copay assistance is important. As you may already know, access to medically necessary treatment is critical for successful patient outcomes. However, this access is often blocked by high cost sharing, which can negatively impact both quality of life and the course of a disease. Assistance for out-of-pocket costs has been a need for so many patients for many years. High cost sharing refers to healthcare expenses that are not covered by an individual's insurance plan and must be paid out of pocket by the patient. These out-of-pocket costs come in the form of deductibles, co-pays, and co-insurance. Patients who have insurance but are unable to afford the out-of-pocket costs associated with their treatments are considered underinsured. In 2019, between 25 to 30 million people were underinsured in the United States. In the past 3 years, an estimated 4.1 million people spent more than 10% of their income on high out-of-pocket costs. At this time, the COVID pandemic is certainly illustrating the gaps in our healthcare system and the urgent need for financial support. With an estimated 16 million people reporting job losses in the past 3 months alone due to COVID-19, the uninsured population is sure to grow even larger this year, creating an even bigger gap in the underinsured population. For many patients with chronic, rare, or life-threatening diseases, this cost of care can add up quickly, putting many patients in the underinsured population. In 2019, Chagall Research conducted a survey to assess patient satisfaction and the perception of services provided by PAN among the patients receiving financial assistance. Prior to receiving PAN assistance, an estimated 51% of patients skipped taking their medications or took smaller doses. After receiving financial assistance from PAN, this number dropped significantly to only 9%, which shows the need for more financial assistance to support the underinsured population. Furthermore, limited access to prescription medications excludes financially vulnerable patients from the benefits of specialty, high-cost, medically necessary prescription medications. Advancements in new therapies could also mean even higher prescription cost sharing, and this increasing burden will once again fall directly on the patient. In the same study conducted by Chagall Research, as many patients face high out-of-pocket costs, and as a result, as many as 94% reported that the support from PAN made it more likely for them to take their medications as prescribed and had a positive impact on their family. While 92% reported that the support from PAN has improved their quality of life and decreased stress levels for the whole family. Finally, 86% also reported that the support from PAN has increased their ability to pay other medical bills. While we advocate to lower out-of-pocket costs, we want to be here to help as many people as possible begin and stay on treatment. It is important to know that during these times, it's imperative more than ever to adhere to your treatment plans and take necessary precautions to follow up with your provider. The Patient Access Network Foundation believes that out-of-pocket costs should not prevent anyone from obtaining medically necessary treatment. And so today, we are going to tell you how PAN can help remove the financial barriers and alleviate high out-of-pocket costs for the underinsured. So with that, I will turn it over to Audrey, who will tell you more.
Thank you, Joan. Let me begin by telling you who we are and how to apply for assistance with PAN. The PAN Foundation is a nonprofit organization dedicated to helping federally and commercially insured patients by helping them pay their out-of-pocket expenses for their prescribed medications. Since its founding in 2004, PAN has provided nearly 1 million underinsured patients with over $3 billion in financial assistance. We have 3 types of assistance programs. First, we have the medication assistance programs, which includes assistance for deductibles, copays, and coinsurance. Then we have the premium assistance programs, which assist the patients to pay their insurance premium. And lastly, we have the travel assistance programs, which helps to cover the cost of approved transportation, lodging, and other travel expenses incurred from the patient's treatment visits. All our programs are provided in the form of financial grants. PAN provides financial assistance for over 70 disease funds ranging from chronic, rare, and oncology diseases. We recently added sickle cell disease to our list of disease funds. In addition, we also launched the COVID-19 Treatment and Prevention Assistance Fund to support those affected by these uncertain times. The COVID-19 Disease Fund is unlike any of our other disease assistance programs in that it covers a range of services, including over-the-counter and prescription medications, medical supplies and equipment, and transportation to medical or pharmacy appointments, as well as groceries and meals. To be eligible for this disease fund, patients must be diagnosed with COVID-19 or directed to self-quarantine by their healthcare provider or government agency. You must also have Medicare insurance and be diagnosed with either a cancer, rare or chronic disease. To see a full listing of all our disease funds, eligibility criteria, and current statuses for our programs, please visit our website at panfoundation.org. A common question we get at PAN is what we cover and do not cover. At PAN, we cover products that are FDA approved or listed in official compendia or evidence-based guidelines for the specific disease fund. These include all prescription medications in each disease fund formulary, such as brand and generic medications, bioequivalent or biosimilar medications, as well as specialty drugs and radiopharmaceuticals. Very few disease funds also cover medical supplies for administering treatments. An example of this is our Parkinson's Disease Fund. So now that you know what PAN covers, it is also important to highlight what PAN does not cover, as we often receive requests for payments for products or services that we do not cover. This includes any medication which is covered at 100% by the patient's insurance. We also do not cover any medication which the patient's insurance does not cover, as well as medications not on our disease fund formulary. However, there is an exception to this rule. So if a medication is indicated or guideline recommended for a disease state, but is not listed on our formulary, you may submit a request on our website, or you can call us to add the drug to our formulary. Finally, we do not cover medical services such as doctor's visits, lab work, genetic testing, ER or hospital visits, and diagnostic testing, etc. Our grants provide 100% assistance support for most of our patients. And we look at historic data as well as industry trends to determine how much a patient is going to need for a specific disease fund and allocate a certain dollar amount to that fund. In instances where the patient needs additional assistance because the out-of-pocket cost is higher than the average, we offer second grants to cover the remainder of the enrollment period. What this means is that if the disease fund is open at PAN and the patient runs out of funding before the enrollment period ends, you can apply for a second grant to cover the remainder of the eligibility period. In addition, we review all assistance amounts annually to ensure that patients receive adequate financial support throughout the year. So it's always important to check on our website to make sure to see if we have updated this amount, because it can change from year to year. The next few slides will focus on how to apply for assistance with PAN. There are 4 easy steps to keep in mind when applying for assistance with PAN. First, check to see if the disease fund that you're interested in is open. Second, we want you to verify if the patient meets our eligibility criteria. Third, gather all the required information. And fourth, contact PAN to apply. So let's go ahead and take each checklist and review what is needed at each step. Step 1, to see if the disease fund is open. There are several ways to do this. you can go on the PAN website at panfoundation.org and type in the name of the disease fund, as shown in our example on the slide. If the program is open, the status will indicate open next to the disease fund name, and the same for if the disease fund is closed, you will see the closed status indicated next to the disease fund name. Another way to verify if a disease fund is open is by visiting our patient, provider, or pharmacy portal to verify if the fund is open or on the disease fund and medications tab. Finally, you can call PAN to verify the current status of all our disease funds. Step 2. Verify if you meet the eligibility criteria for the assistance program in which you are applying for assistance. The following are our general eligibility guidelines for all our disease funds. 1. The patient must be getting treatment for the disease fund in which he or she is applying. This means that if you are applying for assistance with our heart failure disease fund, the patient must be diagnosed with heart failure disease, and the medication you are seeking assistance with must be covered on our heart failure disease fund formulary. 2. The patient must have health insurance that covers his or her qualifying medication or product. Our third criteria is that the patient's medication or product must be listed on PAN's list of covered medications. 4. The patient's income must fall at or below the federal poverty level specified by the assistance program. It is important to note that the insurance and income criteria vary for each program, so be sure to verify this and all of the program eligibility guidelines on the specific disease fund page on our website. Finally, the patient must live and receive treatment in the United States, or U.S. territory, although U.S. citizenship is not a requirement. Now let's get into the specifics of each of the programs that may be of more interest to people working with Mended Hearts. The first disease fund that we provide assistance with is arrhythmia in patients with atrial fibrillation or atrial flutter. This disease fund assists Medicare patients and provides financial support in the amount of $1,500. The next disease fund that we provide financial support is the Heart Failure Disease Fund. This disease fund also assists Medicare patients and provides financial support in the amount of $1,000. Additionally, we provide financial assistance for hypocholesterolemia with a grant amount of $2,400 to support Medicare patients. Now, all three of these disease funds cover the patient's out-of-pocket costs, such as deductibles, copays, and coinsurance. Lastly, we provide financial assistance for homozygous familial hypocholesterolemia premium. This disease fund assists patients with both commercial and federal insurance and provides financial support in the amount of $4,500 to help patients pay for their insurance premiums. On this slide is an example of the Heart Failure Disease Fund page on our website. All of the eligibility criteria, as well as other program information that you will need to verify on the previous slide, can be found on this specific disease fund page. You may access this page on the PAN website at www.panfoundation.org. Here, you can verify the assistance amount allocated to the disease fund, as well as verify the eligibility criteria. You can also check to see if your medication is covered on the specific disease fund page formulary. And finally, you can check to see if your diagnosis code is covered. Step 3, gather all required information. If the patient meets all the criteria listed on the previous slide, you will need to gather the following information before you start the application process. You will need the patient's demographic information, such as the name, address, phone number, and email address. You will also need the diagnosis and medication name, as well as the patient's health insurance information, the patient's income, and number of people in their household. Finally, you will also need the physician and facility contact information. Step 4. Now you are ready to apply for assistance with PAN. There are two main ways to do this. You can either give us a call Monday through Friday from 9 a.m. to 7 p.m. Eastern Time at 866-316-7263, or you can log on to one of our self-service portals listed here. As you can see, each portal is designed with the end user group in mind. The provider portal serves our healthcare providers, whereas our pharmacy portal is intended to serve our pharmacy personnel, and most importantly, our patient portal is designed to serve our patients and patient caregivers. On average, it takes about 7 minutes to complete an application, and our enrollment decision is provided immediately. We'll provide you with the enrollment details and processing information right away, and then follow up with an email or fax to the physician's office. We will also ensure that the enrollment details and processing information is emailed or mailed to the patients as well. Now that the patient is enrolled, there are a few things to consider about the PAN grant. Each PAN grant eligibility period is for 12 months. However, if the patient enrolls for the first time in any of our disease funds, we will help them cover any claims incurred in the past 90 days before the enrollment date. In addition, claims must be submitted every 120 days in order to keep the grant open throughout the eligibility period. This is our grant use policy. You may also apply for a renewal grant as early as 1 month before the end of the eligibility period. It is also important to note that once the grant is approved, that you may begin to submit claims to PAN immediately. We want the reimbursement process to be quick and simple for you, so we provide several ways for you to submit your claims. 1. If the patient receives their medication from a pharmacy, the pharmacy can bill PAN electronically or submit a claim via fax or mail. 2. If the patient receives their medication from the doctor's office, the doctor can bill PAN electronically by fax or upload a claim on our provider portal. 3. If the patient prefers to bill PAN directly, the patient can submit the prescription label or remittance advice for services rendered at the pharmacy, or an explanation of benefits for services rendered at the doctor's office, along with a complete direct member reimbursement form. Additional information on filing claims can be found on our website at panfoundation.org under Get Help. We'll also make sure to communicate with you every step of the way until you receive your payment. Now, we understand that managing an illness is difficult, and our patients who apply for assistance with PAN may need additional support beyond financial assistance. They may also have questions about their disease and treatment, side effect and medication adherence, and they may also benefit from connecting with a compassionate community that can help patients deal with the physical and emotional complexities of their diseases. That is why we have formed alliances with leading patient advocacy groups such as Mended Hearts to provide patients with the holistic support that they need. I think the biggest comfort is knowing that an organization like Mended Hearts is providing important follow-up with patients and much-needed education and support. Financial assistance is so important, but perhaps equally important is addressing patients' other needs and helping them remain adherent to treatment. For patients, knowing that an organization like Mended Hearts is always there to support them is important. And that is why when a patient or caregiver applies a PAN, they are provided an option to opt into receiving communications from a respective alliance partner. If the patient opts in, our alliance partner will reach out to them directly if they're interested in learning more. And I'm really excited that I had this opportunity to tell you about our programs. And I hope that you will enroll with PAN to benefit from the many assistance that we have available for our patients. And now I'll turn it back over to Joan.
Thank you, Audrey. We want to encourage you to stay connected with us once you enroll with PAN. We understand that you have a busy schedule, and because of that, we've made our processes quick and simple for you to stay connected. We provide many resources to help you along the way. One way to stay connected with PAN is through our website. We have redesigned our website to make it easier for you to find the help that you need. By navigating the top menu bar, you can quickly get help, find a disease fund, or explore our many resources available. For instance, on the Get Help page, you can find frequently asked questions specific to patients, providers, or pharmacies, as well as find information on how to apply for assistance, manage your grants, and file a claim. On the Explore Resources page, we have short webinars about our programs, as well as our provider and pharmacy billing guides, and additional resources under the Advocacy Resources page. As we mentioned earlier, on the Find a Disease Fund page, you will find a list of all of our assistance programs, their eligibility criteria, and their fund formularies. We will also provide you with referral information to other foundations if the disease fund you are interested in is closed at PAN. You may also sign up for our new disease fund waitlist, which is a list of patients waiting to apply for assistance from a closed disease fund. This waitlist enhances our ability to serve patients on a first-come, first-served basis by giving those on the waitlist the first opportunities to apply for assistance when the fund opens. People on the disease fund waitlist will be notified via email when the fund opens in waitlist status, and then they can apply before the general public. You can sign up for our disease fund waitlist on our website by calling us or on our portals, which we will discuss next. First, we have our patient portal, where a patient can apply to PAN by simply going to panapply.org to complete a short online application. Once enrolled, a patient or caregiver can manage their account, review their eligibility period and grant balance, sign up for a second grant if they are out of funding, renew their grant starting from 1 month before the end of the eligibility period, and review correspondence letters regarding their account. This can all be done without picking up the phone. If you are a provider or pharmacy, you may also apply on behalf of your patients at providerportal.panfoundation.org or the pharmacyportal.panfoundation.org. Here, you can utilize the same features as on the patient portal with some additional features, such as communicate with our portal support team via secure messaging, access all PAN correspondence letters regarding the patient's accounts, manage your facility's account, review process claims, and run reports. For our providers, you may also upload and submit claims on the provider portal. And finally, announcements and updates are displayed on both the pharmacy and provider portal login pages. PAN has also created a free web-based app called Fund Finder. This first-of-its-kind app helps all audiences track the disease fund statuses across the 9 charitable copay assistance foundations. You can simply go to fundfinder.panfoundation.org, or you can find a link on our website. Once you sign up, you may follow any disease fund and receive notification alerts via email or text message when that specific disease fund opens at any of the foundations. Fund Finder helps you save time by not having to frequently check multiple websites. Our goal is to help you find the support and resources you need so you can spend less time on the manual work. Finally, we know that the PAN Foundation is one of many resources to help patients, and we encourage you to reach out to us. By doing so, we can listen to your needs and understand how we can help. Now I'll turn it back over to Audrey.
Thank you, Joan. And thank you all so much for joining us today. If you would like to sign up today, please contact our call center at 866-316-7263, Monday through Friday from 9 a.m. to 7 p.m. Eastern Time. Or you may apply online at panfoundation.org. Also, you can reach me directly at 202-370-4824, or you can email me at acorte@panfoundation.org if you want to learn more. We look forward to working with you soon. And again, thank you so much for your time, and please stay safe. And now I'll go ahead and turn it back over to Andrea, who will lead our question and answer section. Thank you.
Thank you both so very much for the great information and in making it so easy for everyone to apply. And as I said in the beginning, if anyone has a question, please enter your question into the chat box, which is on the right-hand side in the panel, the very bottom box, and it should say chat. You can type your question in, and I will read it out to our presenters today. While I'm waiting for others to type in their questions, one question is, if you do not have a computer and you apply via the telephone, how will you be notified if you have been approved?
That's a great question. This is Audrey. So if you apply over the phone, we will go ahead and mail you the information. But when you apply, we provide the information to you right away. So we will be able to provide you with the processing information so that if you need to file a claim before you receive your information via mail, you can go ahead and do so by providing the processing information to either your pharmacy or your doctor's office. But in addition to that, we also notify the doctor's office via fax or email about your application and the processing information.
Great, thank you. The next question is, are you able to provide assistance to someone on Medicaid?
I can go ahead and take that as well. So yes, that's why it's really important for our applicants to check our website to find the eligibility criteria for our disease funds. So we do have certain disease funds that are Medicare only. And then we also have other disease funds that are any insurance, so either commercial or federal insurance is accepted. So it's always important to look and see if that depending on what the program is, to see what the eligibility criteria is. So yes, we do have programs where we would assist the patient with Medicaid if they do have out-of-pocket costs.
Great, thank you. Another question, and everybody, just if you have a question, please type it in the chat box and we will get to your question. Another question is, are you provided with a card that you can use at the pharmacy, or do you need to pay out of pocket first and then be reimbursed?
I can answer this question. This is Joan. We will provide you with the processing information if you choose to bill through your pharmacy. The pharmacy will be able to use that information in their pharmacy system so that you don't need to pay for their medications first and then get reimbursement. If you do not want to go through your pharmacy and you as a patient would like to submit your claims by yourself, you can do so by using the direct member reimbursement form and just by including the pharmacy label along with the remittance advice, you will be able to receive reimbursement that way as well.
Great, thank you. So I will give one last call for questions. We have answered all of them that have come in. So if you do have a question, please type it in the chat box. If you also need any other assistance, in addition to the email and contact information for PAN, you can reach out to me at Andrea, which is ANDREA.Baer, BAER, at mendedhearts.org. And I can connect you or get you the information on any other resources that you might need. So seeing no more questions, I would like to again thank the panelists, Joan and Audrey from the PAN Foundation. We really appreciate you taking the time to educate us on these assistance grants. And I also want to say that we appreciate you providing this assistance to everyone. So thank you all for attending, and you guys have a great day.
Thank you so much, Andrea. It was a pleasure. Thank you, everyone, for joining.